Good morning. Welcome back to Kid Focused Dentistry. I am Dr. No. Today we are going to discuss infant care or toddler care. So I'm really excited about this video because we're giving this information to our new mother, and we tend to find that the little ones who start with us at a really young age tend to do so much better long term in their dental health because it's all about getting the right information at the right time. Why we like to get this information to you early is that it is better to create good habit rather than trying to break bad one. And you know, as a mother, you guys have so much things going on. So not knowing the right information, you might inadvertently creating a bad habit, and down the line having to try to break it, and that's a lot more difficult. So I'm excited that you are tuning in for this video, and hopefully you'll find this video very informative. As you all know by now, breastfeeding, you know, there's a lot of science behind it, that it is a really important component to, you know, helping your child grow well. So here's another reason from the dental side why we highly encourage breastfeeding. And that reason is to promote correct growth and development head and neck wise. You know, when we have a new little one, we assume a lot of things is a natural habit, but one of the things that is not an instant habit is the swallowing habit and the tongue placement. So with the breastfeeding, what it does is it teaches your child how to correctly swallow. And why does that matter? First of all, it will help your child to have the correct movement of the tongue, so then when they swallow, the fluid is correctly flowing down to the throat without negatively impact the oral environment. So when I swallow or when a correct swallow is happening, what you get to do is the tongue is on the roof of the mouth and it's rolled backwards, so then the fluid can kind of go into the back of the throat. And that is learned from breastfeeding. So as your child learns how to breastfeed, he or she has to milk you, so that it's teaching that the same roll, so that it's pushing against the breast and then getting the fluid and it's going in the back of the throat. Versus something if you're introducing a lot of bottle feed, what that happens is your child will go into a piston motions. So that will cause a lot of problem like incorrect swallowing, and that will cause problem speech, a growth problem, incorrect airway problem. So if you can, you know, I am a working mother too, so I know that it is extremely difficult, but whenever you can, try to breastfeed, because this will really help your child to grow correctly. If you have any problem, make sure you have a good pediatrician to help you diagnose problem with the breastfeeding, a good nurse practitioner. A great website that we like to recommend for a lot of parents is Breastfeeding Coalitions, and we'll provide the link below. There's a lot of great resources for new mothers, especially the one that are having breastfeeding problem. We also have a link to the video, to the part we're talking about different type of ties that can cause with breastfeeding problem below for you. We always want to think about what habit, even though it seems very simple, will cause a lot of detrimental effect down the line, whether that is thumb sucking or pacifier. If you think about it, pacifier is such a new technology that introduces to our society. A lot of time, you know, once the parents have used it, they almost kind of felt like they are in a way enslaved for it. So it's really, really difficult for us to try to get rid of it. But the reason why we don't encourage oral habit is because it does interfere with the growth and development, and it interferes with your child's ability to self-soothe. So the whole science behind your child getting addicted to these oral habits is that whenever there is pressure that's pushed on the roof of the mouth, there is this chemical called oxytocin is released. It's a calming chemical. So this is a great chemical for your child, especially when they're crying and learn to self-soothe. This chemical really helps with that. The reason why the body is creating this kind of mechanism is it's want to encourage the tongue to go onto the roof of the mouth. When the tongue is going onto the roof of the mouth, what happens is that tongue is exerting a certain amount of force. It's create an expansion for your child, the arch right here, to grow outward and forward. And that is the correct pattern of growth. And so now we're looking at pacifier or thumb sucking. What happened during that time? So when they use a pacifier or thumb sucking, what happened is they create this really strong pressure, a lot more than what the tongue can do. And the strong pressures, of course, release a higher dose of oxytocin because it's higher amount of pressure. This is why your kids that is pacifier, using the pacifier or thumb sucking, have that glazed over look whenever they're sucking on it. They're getting really addicted to it. But why is that bad? So the type of force that a tongue exerts is a wide amount of force. Versus if you do a pacifier, it's just a very focused amount of force. So it doesn't help expand the arch. What it does is it collapses the arch. This is your upper arch. What happened when the arch collapses? It's like this. Right up here is the airway. So then you will collapse the airway a little bit on there, and over time create incorrect growth that will create mouth breathing. The tongue is usually, when they're not sucking on the pacifier or thumb sucking, on the floor of the mouth, and then you get tongue burst, so then the jaw is growing wrong. So overall, the healthy oral environment is really thrown off by that. So we want to encourage, if all possible, don't even start with the pacifier. There are very few kids who have a severe tongue tie. If it's not being diagnosed early, will really crave the pacifier, and that's, those are the kids that we probably don't know how to self-soothe. And I highly do encourage, do not use that straight one from the hospital. I like the flatter one if you have to use the pacifier, because it spread out the force again a lot more than rather than just focus that force in one area and does a lot of damage on there. But if you have someone that help you diagnose all these ties, that will really eliminate the problem. And allowing your child to learn to self-soothe, that is part of correct growth. So as they learn to get that tongue up there, exert its own pressure, it will help them, encourage them to go into correct growth. Study have shown that if the latest that we encourage for you to break the oral habit is by 5 months, which is go by really, really fast. So if you don't start with the habit in the first place, it'll be a lot easier for you. Hopefully this will create a healthier child with a healthier growth. If you have any questions, please give us a call at 303-543-8338. And also look below for the link of all the related videos, especially the ones that help the breaking the habits on there. And also check out our website. We have a lot of really great information on there and great references if you need that. Okay, thank you and have a great day.